everyone. Welcome back to Unmasking Mondays. We are kicking off episode 2, picking up from our conversation last week with Dr. Maggie Majapelo, where we spoke about autism and creating safe autism-friendly spaces. We touched a bit more about how families and communities can support those who are navigating the spectrum. And so today we are delving into the conversation a little bit deeper and really understanding autism through the lens of play therapy, especially as it relates to children and their families navigating the spectrum. I have the honor of speaking with Anna, who is a play therapist, and she leverages integrative play therapy approaches and play filial coaching to help families, educators, and ecosystems in which children exist to better support them as they navigate the spectrum. So thank you for coming.
It's a pleasure being here.
Awesome. So can you tell me a bit about you and what you do?
Sure. So my name is Anna. I'm an internationally recognized play therapist and filial play coach. Let's look at what the differences between those two paradigms are. So filial play coaching is working with parents and helping them understand their child's world through play. And in play therapy, it's working that I work directly with the child, utilizing play to understand their challenges and their experiences.
Okay, brilliant. And tell me, what is one of the things you pick up most when you're navigating coaching caregivers and families around how to support their children through the spectrum?
Okay, so the number one thing that we focus on is how do we understand your child through their world? And the first thing that we do is how do we step back and observe our child in their play world, in their world.
Okay. And is there value in play therapy for adults? So we speak about, the people on the spectrum navigating the human experience quite differently. So what is your take on that?
If we look at play in general, it gives us an opportunity to step away from this pressure-filled world where we're often having to match or meet a certain level of social interaction, communication, just general everyday experiences. In play, we can step back and move into a world where we can make mistakes. We can experience creativity and curiosity, and that allows us to synthesize our life in accordance to who we are and not about the standards we're trying to meet.
Okay. And so if I wanted to do play therapy, could I?
Absolutely.
Okay. Great. That's a date. Okay, so now let's take a bit of a step back. Can you tell me in really basic terms what autism is?
Okay, so autism rests on a spectrum, and essentially it's characterized by individuals having challenges with social and communication areas. So they struggle to relate to other people and to share their experience through language and understand how others are sharing their experiences with them through language. Mm-hmm. Another important feature is children with autism tend to enjoy repetitive activities and will have repetitive behaviors. So often the common one is stimming. And another one is for kids who are sensory overload in terms of auditory processing, is covering the ear. Right. Is another common symptom. So I'm going to hone in on behavior as a way of understanding the importance of language and how it shapes our understanding. Mm-hmm. So at the core, we view every behavior as an attempt to communicate what's happening. So can you see that shift in language? It's not my child is acting out, mm-hmm. which is boxing them in a certain light. It's saying these behaviors are attempting to signal to me, communicate to me that something is happening in their world that they need support with. Okay, and what play therapy does is it helps facilitate understanding around this nonverbal world and how we can better understand it.
Okay, yeah, it's very interesting. I think one of the things that people struggle to understand is the spectrum dynamic, right? So how some people on the spectrum are nonverbal. And so I think play, what I'm understanding, is a really good way to try and pick up and understand what people are trying to communicate. Because you mentioned something very interesting when we were offline about play kind of creating a very unpretentious environment where people can really, experience something without the pressure of an outcome. So I want to delve a little bit into that, and because I also want to play as an adult. So I want to just understand how we can possibly look at integrating play therapy into adult life and potentially into the workspace.
Okay, so beautiful question, and I think it is an experience that needs to be explored more within the workspace. So play therapy allows us to take a step back and connect to ourselves, and through that connect to others. Now, at the foundation of any work experience is play, is connection. And what play does is it helps move our attention away from either the focus of attention or the focus around, I need to achieve something brilliant.
Right.
Yeah.
Okay. Well, I think I'm also, obviously I know your experiences around play, being a play therapist, but the ecosystem that people exist in, children as well, it delves into different areas, So we spoke a little bit about play in the workplace, but can you double down on educators? So if I'm an educator listening to this and I want to equip myself with knowledge, or I want to better understand how to identify potential signals that children in my class might be, potentially be on the spectrum. What should they be doing, looking out for to help them better navigate that space?
I think it comes down to open yourself up to resources, open yourself up to people who can help you understand this world of autism. You can reach out to me at Mediwell, and we can look at facilitating workshops around what are the signals of autism, how can we support children who are showing these signals, what do I do when I feel overwhelmed in these moments? This is a very natural part of the process. And for parents, teachers, caregivers, how do I manage this feeling of being overwhelmed and not have any shame attached to it? And all of that can be facilitated through filial play coaching or play therapy techniques.
Okay, great. So, in kind of closing the discussion, which I'm really sad for, we need a part two. How can you, or what are any parting words for parents who maybe have newly diagnosed children on the spectrum, and they're really struggling to process those emotions? As a mother, I'm a mother myself. When things like that happen, you often blame yourself. What did I do? Where did I go wrong? There's a myriad of emotions. And it's not a one-dimensional answer, I know, but what are some really tangible words of encouragement you can leave parents with if they're sitting in that space?
The first thing that comes to mind is give yourself grace. It's about being in that experience and not running away from it. It is an incredibly overwhelming experience. Going forward, it's not about finding strategies to try and correct this new information or try and reduce any of this behavior. It's around how can I now broaden my capacity for understanding this new paradigm, this new way of communicating and connecting.
That's beautiful. And with that, thank you for joining us on Unmasking Mondays. I think it was really great having you, Anna, really just trying to understand the human experience in general, but how to better understand autism and the spectrum. We'll definitely be having more engagements with Anna as we try and peel back the layers around autism and neurodivergence in general. Lastly, how can people find you, Anna?
Okay, so the easiest way to find me is on the Mediwell website. You can find all my contact details there, or alternatively phone reception and I'll direct you to me or provide you with all my contact details.
Brilliant. Yeah. So there you have it. And thank you again for joining us on Unmasking Mondays. We look forward to journeying with you as we peel back the layers of mental health and better understand the nuances around not only navigating the human experience yourself, but also how to support others as they navigate their mental well-being journey. We'll see you next time. Bye.